Press conference today is to address some of the misinformation and get some facts out about healthcare that we are hearing within the community. And I want to make sure that that's clear to residents who will be making a vote, who will be casting their vote on December 13th. And I want to take you back to some recent published headlines. Winnipeggers react to the worst hospital wait times in the country. That was from CBC. Hallway medicine alive and well. That was from the Winnipeg Sun. And this was based on a report that was released by the Canadian Institute for Health Information, which identified 4 of the 5 slowest emergency rooms in Canada were here in Winnipeg under the Sellinger-Canoe NDP. We cannot go back to the mismanagement and mistakes of the NDP past. The hospitals that were included in the top 5 were St. Boniface General, Victoria General, and Concordia. They were among the bottom 4. However, right here in Kirkfield Park, Grace Hospital topped the list with the longest recorded ER wait times. This is a fact, and it's undisputable. This placed the Grace Hospital in the 90th percentile, that is the maximum amount of time 9 out of 10 patients waited to see a doctor. And keep in mind, this was pre-pandemic. Over the last 6 years under the watch of the PC government, over $77 million is being invested into the Grace Hospital, updating diagnostic testing equipment, and $44 million for a new state-of-the-art emergency room, repairing what was broken. The Premier has already announced support for a new Grace Hospital ICU, and that was committed several weeks ago. And let's not forget the investment of $200 million to retain, attract, and train new healthcare professionals. That's unprecedented. All across the country, we have an issue with skilled staff, especially in the medical industry. And this government has made a historical investment of $200 million to attract and retain medical professionals. That's how we address more of the problems. Action is being taken. And if I'm fortunate enough to be the MLA for Kirkfield Park, I will continue to press for our hospital and will ensure surgical wait times continue to drop as they have been over the last several months. For example, there is no wait list for cataract surgery. The knee and hip replacement waiting list has dropped and continues to do so. These are facts, and again, they are undisputable. After several personal meetings with paramedics and a chance to listen to them and talk about their concerns and most importantly, their suggestions, and then taking their suggestions and talking to other jurisdictions, I was an advocate during the civic campaign for a change how we utilize our paramedic staff. And as an MLA for Kirkfield Park, I will advocate for changes to happen within the paramedic system. Changes that will ensure we are utilizing our advanced care paramedics properly and the community paramedic units, which will improve service to all residents in Kirkfield Park and throughout the province, and will greatly reduce the visits to hospital because work can be done in a different way. I have proven my commitment to this community in my former role as a city councillor, my commitment to public safety as a former chair of the Winnipeg Police Board, and I would be grateful to represent Kirkfield Park as the MLA because there is much work to be done, and I am up for the challenge. The PC team is working to fix the mistakes of the NDP. I'm listening to residents. The PC team is listening to residents to find solutions. Not create fear, not create misinformation, but to find solutions. Thank you. I can take a few questions if you'd like.
On Grace Hospital, you're talking about historic wait times, emergency room waits being at record levels, but there is an issue in the emergency department today. How do you explain what's going on today in the emergency department at Grace Hospital and the issues that patients are facing there?
Well, I think what we're seeing is, in my opinion, in talking to paramedics and stuff, is that we're having a lot of visits to hospital because we're not utilizing our advanced care paramedics or the community paramedic units that could be expanded upon. That's one thing that I would like to advocate for, that I think will drastically reduce visits to the hospital. Because if you have a strong advanced care paramedic or community paramedic unit program, you can then direct, to make sure people get the right care and are directed to the right place for treatment, whether that be a specialist or the hospital or a doctor later down the road. So that program will help, reduce the visits. Now, we know that we're going through a pandemic, and we know right now we're going through a major flu issue here in our province. We're seeing it across Canada, in fact. So the government can't really ensure people don't get sick, but we can put all the programs out there. We have the flu shots that are available and so on. The other thing that I think is the problem is staffing, right? We're having an issue with staffing. And I had an interesting conversation with a nurse who's been in the business now for 25 years, who said 20 years ago, they were talking about in university when she was becoming a nurse, about a shortage of medical staff that would happen in Canada within 20 to 25 years. And here we are. And I asked her why that was, and she said, well, back when she went to school, there was very few positions within hospitals in Canada, and a lot of individuals at that time would go down to the U.S. But they knew, by looking at the data and looking ahead, that a lot of staff would be at the retirement age, and it looked like it was all going to happen at one time. And now here we are. So I think the $20 million investment is the most beneficial action that we can take. So we have to reach out to people and have them come to Manitoba to practice medicine. We have to help train individuals. We've done that by adding more spaces in schools, and we have to make sure that we retain the staff that we have, and that will also happen through that money.
Yeah, I just asked about, I'm sorry if I've got this wrong, but the community paramedic program you're talking about, is this something that you, province, would have to work with the city on then to establish, or is this a...
Yeah, I think the province would have to work with the city on the community paramedic program, but a former colleague of mine is in the mayor's chair right now, and I think Mayor Gillingham is open to having conversations that will improve life and the quality of life within Winnipeg, and that providing medical treatment and medical service through the Winnipeg Fire Paramedic Service. And community paramedics is one of those ways to do that. So I believe that, in conversations as a counselor with Mayor Gillingham, at the time he was a counselor, I believe that he is open to these discussions, as well as the members of the Winnipeg Fire Paramedic Service.
What about what kind of support has the party signal for this kind of, or government has signaled for this type of...
Well, I'm signaling it right now, and that I will be pushing for it.
Thank you. Any other questions?
Can you can you maybe even just elaborate on this a little bit more? Like, how would this community paramedic be different than what's already on offer?
Well, it's very similar, but if you followed me in the civic world, we talked about having advanced care paramedic response units. That's like the community paramedic program. But in this case, you would have your advanced care paramedics responding to select calls where they would determine the treatment necessary. So they do this in other jurisdictions in Ontario right now. Ottawa has a number of these advanced care paramedic response units, and they're able to go to somebody's house, and if they just need a certain medication, they're able to administer that medications. Right now, if somebody calls 911 or calls for an ambulance, the fire truck will show up, and then we wait for the ambulance to show up, and that's why we're seeing some backlogs, and that's why we're seeing some wait times go up. So with the advanced care paramedics, they have the opportunity to go there, they have the training to assess exactly what the patient needs and determine whether or not they need to go to the hospital or arrange an appointment with a specialist, and they can do all of that on site. In fact, in other jurisdictions, the advanced care paramedic response units will even administer IV if that's necessary because somebody's had an operation. And they can do the treatment at the person's home, as opposed to having to take them to the hospital for something that may have been able to be treated in their home.
On the cataract surgery, you said there's no wait list. How do you explain that there's no wait list? There's at least 4,000 people waiting for cataract surgery.
I believe yesterday at the legislature they announced that the wait list is now back to is gone for cataract surgery. That they've caught up.
It's pandemic backlog. The pandemic, there's still at least 4,000 people on.
Okay,
wait
well,
list.
okay, fair enough. That's a fair correction. Pandemic backlog, and if I'm fortunate enough to get in as MLA, I'll still be pushing for changes to make that faster.
There was a press release issued last week on some of the misinformation and as you described it about your employment with Nygaard, and there was a line in the press release saying, you do whatever it takes to stop that sort of conversations from happening, to stop that that messaging from opposition MLAs. Are you considering any legal action, getting employers involved? There are statements that have been made that are not protected by parliamentary privilege.
You know what? I'm not going to comment on the lies. It was a ploy by the NDP to get media to cover them, and that's all it was. So I'm not going to comment on that any further.
Okay, anyone else have questions?
There's a nursing shortage. What's your plan to correct that?
There's a nursing shortage all across this country, and I think that the PC team has already taken the right action to address that by increasing the number of opportunities to be educated. And they've also said that they are investing $200 million, unprecedented, $200 million to retain and attract medical personnel. That's how we address that. But remember, we're competing with the rest of Canada. We have to compete bringing nurses here. It's one thing to say I could stand up here and I could be like other political parties or other politicians, which I have worked hard not to be, and say, if I'm elected, I'm going to fight to make sure all hospitals are fully staffed. But that's not fair, because we have to attract those people. We have to make sure we don't lose people, and we have to make sure that they're coming to our province. So that's how I would address that, is make sure that the $200 million is being spent appropriately and continue to follow up on it through the government.
Why should voters believe that you and the PCs are the right party to fix healthcare when there's been a myriad of issues over the last number of years? And you bring up numbers here from 2014, but a lot of these issues remain. You're talking about announcements, but that's in the future, and the PCs have been in power for 6-7 years now. Why should voters choose the PCs?
It's a really good question and a fair question. And the reason that I wanted to be a part of the PC team is because I see the evidence that they're listening. And that's what's most important right now, is that we're listening not only to residents, but that we're listening to staff. I had a telephone town hall recently where a president of an organization with healthcare workers, didn't identify themselves, said no one will listen. And I offered on that call, with other people on that call, to meet with them at any time, to sit down, because I'd like to hear. I'd like to hear what the solutions are as well, not just the arguments. Let's talk about the solutions. But I haven't heard back from that organization yet. So it's easy to say that nobody in government wants to talk to them, but all I can do is offer to meet with them, and then they have to take that next step. I also think it's important to note that with the healthcare system, we're failing. We're seeing that across the entire country, and that is because of the Liberal NDP coalition. And that's a fact. We know that the money being sent to provinces is far inadequate to what we should have. And we're not the only province facing that. So we have to look at the source of the issue. We have to look at the larger picture. So there's two here. Number one is that since, and even before, you're right, even before 2014, we were making changes, or the NDP government was making changes to healthcare that have hurt us. And you can't fix that problem overnight. The wait times and such right now is because we did create the $200 million to start addressing that. The NDP didn't. We lost staff during that time. It's not as easy as turning on a button and bringing staff back. We're going to have to work at that. And that's why you need to make that investment. But we need to be clear and honest with people of Manitoba. The fix is what we're doing today. The fix is what the PC team is doing today. The $200 million. If you look back to the report you're talking about of 2014, since then, $44 million was invested into the Grace Hospital to fix and make a state-of-the-art emergency room. That is taking action. So when you're trying to resolve a problem, there's not one answer. There's short-term answers and long-term answers. And I see this PC team making the short-term actions achievable, and they're looking at the long-term plan with the $200 million. That, to me, is an action plan that works.
What would you say is the state of the Grace Hospital right now?
You know, I can speak to this personally because unfortunately my wife and I, her parents are suffering from some serious health ailments, and we spend a lot of time at the Grace Hospital. Some days we see a lot of people in the emergency room. You know, if that's where we go. Some days it's not so bad. Some days there's long waits, and some days there's not long waits. And again, I want to go back to a long-term solution, and that's being able to utilize our advanced care paramedics and community paramedic units. Because that will stop somebody from having an issue from having to go to a hospital. You know, we are looking at ways of addressing the wait times, but I don't think it's a secret. I don't think anyone's trying to shy away from the fact is that we need more staff. And that's what we're trying to do, is bring more staff. It would be very easy for the Premier or the PC team to say, yes, starting tomorrow, we are going to make sure that every hospital has enough staff. But how are you going to do it? So the PC team has said they are going to do it. The NDP hasn't said how they're going to do it. How are they magically going to find hundreds and hundreds of nurses and doctors to move to Manitoba overnight to achieve the plan they continuously talk about? You have to have an actionable plan that people can look at, that can be followed up upon, and that's what the $200 million investment is, an actionable plan. And I intend, again, if fortunate enough to be the MLA for Kirkfield Park, to hold the government accountable to that. I want updates on how that's working.
So we have an event to get to. We have time for maybe one more question.
That's the perfect time.
All right. Yeah. Thank you very much.
Listen, thank you very much for coming. I appreciate it.